waking you up to the UAE's conversation. This is Talk Breakfast with Vivek Sunil and Sobia Khan on Talk 100.3.
स्वागत है आप सभी का in the final hour of Talk Breakfast on Talk 100.3. Lovely Thursday morning, and we have equally interesting guest in the house once again, and this time it's Dr. Pooja Sathe. She is specialist Endodonticist. दांत होते हैं ना उसमें?
Yes, देसी स्टाइल में यही कहेंगे हम उन्हें.
हम देसी
दांतों के डॉक्टर पूजा हमारे साथ.
सारी देसी काम मतलब
आपके 32 को ठीक करने के लिए आ गई है हमारे स्टूडियो में. उनसे हम बात जरूर करेंगे. एंड शी इज अ स्पेशलिस्ट ऑन्टोडोंटिस्ट.
अच्छा विवेक, ये मेरे साथ ही होता है, ये आपके साथ भी, कि जैसे कोई कहे कि वो डेंटिस्ट है या ऑन्टोडोंटिस्ट है तो फौरन आप उनके दांतों की तरफ देखेंगे इससे पहले कि वो देख लें आपके दांत.
मैं अपना मुंह बंद कर लेता हूँ. मैं बोलता हूँ मेरे दांत ना देख ले कहीं पे और उस पे कमेंट्स ना आए. सो वील हैव एन इंटरेस्टिंग कन्वर्सेशन.
I think so, but I have to say, not because you are in front of us, Dr. Pooja, you do have a beautiful smile. God has gifted you with that, but I think you help people have a healthy smile and of course healthy, dant life. क्या कहेंगे उसे विवेक?
Yes, all this coming up. सुनते रहिए.
This is Talk Breakfast with Vivek Sunil and Sobia Khan on Talk 100.3.
So yes, Dr. Pooja Sathe, हमने काफी सारी चीजें तो उनसे ऑफलाइन ही ऑफ एयर ही पूछ ली थी. 3 साल हो गए हैं उनको यहाँ यूएई में, लेकिन काफी सालों से इंडिया में प्रैक्टिस करती रही हैं. एंड हैप्पी टू हैव यू इन द स्टूडियो. आप कुछ कहती क्यों नहीं, कुछ बात क्यों नहीं कर रही? गुड मॉर्निंग.
Good morning. A very good morning to all of you. Well, yeah, it's a pleasure to be here this morning.
सबसे पहले तो हम ये जानना चाहते हैं कि ख्याल कैसे रखे दांतों का, वो तो ठीक है, लेकिन आप स्पेशलिस्ट ऑन्टोडोंटिस्ट है तो देयर आर सम एरियाज इन डेंटिस्ट्री जो आप स्पेशलाइज करती है.
Yes, that's correct. So the specialty is called as Endodontics. Okay. So as the name suggests, endo means inside and dontics means tooth. So as a specialist endodontist, I specialize in the deepest part or the deepest core of your tooth, which is the pulp. So to give you an analogy, the pulp is like the heart of your tooth. It is that structure of your tooth that keeps your tooth alive, healthy, hearty and beating.
Nice.
Wow, that's a beautiful way of explaining, easy to understand. ऐसे ही डेंटिस्ट तो ऐसा ही होना चाहिए जो आपको अच्छे से समझा दे. लेकिन रूट कनाल सबसे पहले जहन में आता है जब आप इस पल्प की बात कर रहे हैं या इन डेप्थ सिलसिले की बात कर रहे हैं, और उसके साथ दर्द जहन में आता है. विद टाइम हैज इट गॉट बेटर? Do you have any good news for such people?
Okay, so firstly I would like to say that root canals are not painful.
क्या कह रहे हो आप? मैंने 3 करा लिए हैं.
So the root
इतना चिल्लाया हो कि पूरा बिल्डिंग आ गया है डेंटिस्ट के क्लिनिक पे.
Really?
हाँ.
So that is why we are here. Like we as endodontists.
Thank God you're here.
We are also called as root canal specialist.
Nice.
But endodontics as a field, we, as a specialty, we deal with everything beyond endodontics, like everything beyond root canal treatment as well, which includes like deep layered fillings or post and core, which is like tiny screws which are placed inside the tooth to make the tooth stronger. Wow. Root end surgeries, periapical surgeries. So basically as a specialty, our focus is directed towards saving your natural teeth as much as possible.
Yeah.
So I always like to give this example, like when you need a root canal, it's almost like your tooth has suffered a heart attack.
Barabar,
right?
Barabar.
And by doing a root canal treatment, we are doing the bypass surgery of your tooth.
Correct.
So we are making your tooth alive and we are keeping your tooth active, healthy and in function in spite of the fact that it has suffered a...
So we are talking about a stage when the damage is done. How we can avoid this damage? And I have noticed that with time, root canal is such a common thing.
Yeah, because you have to save the tooth. और इतना कैविटी हो गया है, पहले ही आपने ध्यान नहीं रखा और इसकी वजह से ये हो रहा है. बट क्या कर सकते ताकि हम रूट कनाल तक ना पहुंचे?
That's a very good question. I'm glad you asked this question because then, as I said, root canal or the pulp is the core of the tooth. But before that, there are 3 other layers which protect the tooth. That is enamel and dentine. Barabar. So if you come to your dentist or if you keep a regular follow-up with your dentist, and we can kind of nip it in the bud and kind of address the decay well before it reaches the pulp, it can definitely, you can save your tooth to go to a root canal. So that's why we always recommend that you visit your dentist at least once in 6 months so that the dentist can have a thorough checkup and make sure that if there are any decays or cavities, that can be spotted well in advance to prevent, from the tooth hurting or reaching that stage where it starts hurting and then you visit
Dr.
the
Pooja,
dentist.
we have heard even root canal in children.
Yes, that's true. That does happen.
Yeah,
What
because
would
of
you
too
say?
much candy consumption and no brushing, because wo to bacche bhi hai, they don't know how to do it. I mean, how much as parents will you keep brushing their teeth, right?
Yes, that's correct. That's because children per se, they lack the dexterity to do proper toothbrushing. That is why we say that parents should help the children with brushing. And we also recommend using fluoride based toothpaste or fluoride treatments for kids right from an early stage, so that it gives them a good discipline of maintaining their oral hygiene. Plus fluoride helps in remineralization of their tooth and makes the outer layer of the tooth, that is enamel, very strong and resistant to decay.
And nowadays you see these toothpaste with clove, with coal
With
and
salt, namak, toothpaste.
salt, and maybe whether it's just commercial, just
Well, it's anything that motivates you to brush is good.
Okay.
Is good
Achha.
enough.
so
I
one
would
in the
say.
morning, one in the night, and when kids have candies right after that,
Yes.
what would you say?
Every time, I agree that ideal would be brushing your teeth every time you eat something sweet or sour. But every time brushing is not possible, especially in kids. Even adults, as adults, we struggle to brush 2 to 3 times in a day. So even when brushing is not possible, make sure you at least rinse your mouth after a meal. And even if rinsing is not possible, because we have this culture of eating on the go or grabbing a snack, so every time rinsing is also not possible. So after a meal, make sure you at least take a sip of water, rinse it or swish it around your mouth and then drink off that water. In that ways, we prevent any sugary or starchy foodstuffs getting stuck onto your teeth, and also we prevent the acid from the food, which lowers the pH of your oral cavity and makes the tooth more susceptible to decay and damage.
Correct. Now, एक बहुत अच्छा point आपने कहा कि आपको हर 6 महीने डेंटिस्ट के पास जाना चाहिए, एक चेकअप
Yes.
आपको करानी चाहिए.
Yes, that's correct.
And I know it's a long shot that I'm talking about कि इंश्योरेंस जब तक होता है, it becomes very easy for the person to do that, and करते हैं काफी लोग. But जिनके पास नहीं होता, they plan a trip to India and then they come back from there, वहाँ पे root canal करते हैं. And I've noticed people have had real problems doing that, क्योंकि आपको एक सिटिंग में नहीं होता, you have to do multiple as well. So ये सब barriers को भी कैसे solve कर सकते हैं, if you have any thoughts on that as well?
Okay. So number one, I would like to say that since you brought this up, that endodontics as a specialty has evolved over a period of time. Modern day endodontics, the root canals that we do today are so advanced thanks to the introduction of technology and the boom in digital dentistry. We have we do single sitting root canals. We have
Wow.
cone beam.
Are you serious?
Yes,
Single
that's
sitting?
correct. Yes.
अरे ये तो कमाल हो गया यार, single sitting.
आपने आखिरी बार कब करवाया था?
3 साल पहले
Okay, so
मैंने तो इम्प्लांट कराया था.
oh, अच्छा.
दांत ही गोल हो गए मेरे.
Back home or here?
इतनी मार पड़ती थी घर पे बीवी से.
So if you save, that's what I'm saying, that if you save your tooth in time, there is no need for you to extract the tooth and go to the stage where you have to place an artificial tooth in your mouth. It is better that you take efforts to preserve your natural teeth as much as possible. And we as a specialty are directed towards maintaining as much as your natural tooth structure as possible.
My dad had suffered a little heart patient है वो, और उनका valve replacement हुआ. और we went to this very famous doctor in India, जहाँ पे वो बैंड्रा में है उनका. उन्होंने कहा सबसे पहले तो आपका अपना रूट कनाल ट्रीटमेंट्स कराओ, आपके दांत सारी क्लीनिंग करो, बिकॉज मोस्ट ऑफ द जर्म्स व्हिच अफेक्ट योर हार्ट इट कम्स फ्रॉम योर माउथ.
बिकॉज I know what you're
That's
saying,
correct.
because ये एक I was looking at a video जिसमें वो बता रहे थे कि जो आपके टीथ के इर्द गिर्द whatever
Germs.
is exactly the same thing was found on
the
the heart.
Yeah.
So that's why they say, and that's
So
why
this is very serious what we're talking right now in terms of
Absolutely.
teeth ka treatment. Yeah.
I don't know back home, Dr. Pooja, because you've been practicing in India, you'll be able to shed light on that. But especially in Arab world and otherwise many other countries as well, if you have heard the word miswak,
Yes.
that is also extremely healthy. And
Absolutely, yes.
there are doctors sometimes they say that your gums have a habit of eating food. I don't know. I think gingivitis or something that
Yes.
in medical terms. So it helps in that, and also what we spoke about, that on your heart you'll find similar stuff. So miswak help with that, and on top of that, good brushing.
Yes.
Electric brushes as well, are they worth it, or it's more of a glam quotient?
So to answer your question one by one, firstly, yes, that your mouth is like your gateway to anything that enters your mouth and enters your body, right? So obviously it is very important to maintain good oral hygiene, because whatever you eat and drink is going to go into your system via the oral cavity, via your teeth. So it is like oral hygiene is imperative. I also like to give an analogy, like when your tooth suffers like your root canal, it's like a heart attack, right? So it is very important that you take good precautions, and you maintain your oral hygiene very well. Electric toothbrushes, yes, again I said it is just a mode of motivation. Especially in kids, we advise using electric toothbrush, because kids usually lack the dexterity, and if you tell them that yes, it is like a gadget, it's like a toy, so they're more motivated to use it, and it makes brushing more fun. So anything that makes incorporates this habit and this discipline, it's good.
Discipline, exactly.
So
when we come back, Dr. Pooja, we'll talk about all the facilities when it comes to root canals, because this is like all new age, information that we are getting in Medstar.
Correct.
How easy it is to approach Medstar and get the root canal done, and of course more information that you would like our listeners to know. But right after this.
This is Talk 100.3.
एंड आपको पता है कि जब भी हमारे साथ इंटरेस्टिंग गेस्ट आते हैं, वक्त बड़ी तेजी से निकलता है. कुछ आप पूछना चाहते हैं, नाउ इज द टाइम. डॉक्टर पूजा आपको मेडस्टार में मिल सकती हैं ऑन 0586861003 इफ यू वांट टू नो एनी क्वेरीज. अदरवाइज हम कोशिश कर रहे हैं कि वी कवर एवरीथिंग अंडर दिस ब्लैंकेट ऑफ रूट कनाल्स एंड थिंग्स,
एवरीथिंग. वैसे ये व्हाट्सएप नंबर हमारा है 0586861003. सवाल आप यहाँ पे पूछिए. और इफ यू वांट टू गेट इन टच विद डॉक्टर पूजा साठे, स्पेशलिस्ट ऑन्टोडोंटिस्ट है वो, एट मेडस्टार एस्थेटिक्स एंड मल्टी स्पेशलिटी सेंटर ऊद मेहता में है. आप गूगल कर लो, आपको पूरा इन्फॉर्मेशन मिल जाएगा. बट मेडस्टार एस्थेटिक्स एंड मल्टी स्पेशलिटी सेंटर अगर आप इंस्टाग्राम पे भी देखोगे तो काफी एक्टिव है, वहां पे भी सारा इन्फॉर्मेशन मिल जाएगा.
यस, और इन्फॉर्मेशन यहाँ पे भी हम चाहेंगे कि जिस तरह बता रही हैं कि पेन का वो लेवल नहीं रहा, कुछ और भी एडवांसमेंट हुई है. टेक्नोलॉजी हैज गॉट बेटर टू मेक पीपल्स लाइफ ईजियर व्हेन इट कम्स टू देयर माउथ.
Yes, absolutely. In fact, at Medstar, we have state-of-the-art technology. We have all the latest advancements and equipments. Like we have a dental operating microscope, which makes treatment high quality and very precise. I would like to take this opportunity to ask you a question. That do you know what is the size or dimension of a root canal inside your mouth?
No.
Less than 1 millimeter?
Yes, you're... You are closer.
Close?
It's in microns basically. That is 1,000th of a millimeter.
1,000th of a millimeter?
Yes. So to give you an example, a root canal is finer than your hair strand. And luckily a hair strand is single and flexible, unlike the root canal, which comes in, it's mostly very curvy, and it comes in different shapes at times, like an S shape or J shape or C shape, which increases the
there
complexity.
Yes.
Yes, okay. Every root canal is different. It's like you can say that in my career and in the experience of 15 years, I must have done like over 10,000 root canals, but each root canal is different. So it's like a mystery maze.
It's like a thumb impression.
Yes, absolutely. Yes, each root canal is different.
Since आपने कहा that single appointment में होता है, I would ask this question again. Dr. Pooja Sathe, is root canal painful?
Okay, so root canal treatment is not painful. It is the infection inside your root canal that gives you pain. And root canal treatment, believe me, is directed towards relieving you of the pain, to alleviate your pain and to make you comfortable. So root canals are not painful. It is the ignorance that makes it painful. So visit your dentist well in time so that you do not have to bear through the pain. Secondly, what I have also noticed is that when a patient comes to a dentist, it is the fear of the dentist, or it is the anxiety of dental treatment that sometimes even oversees or supersedes the tooth pain as such. Right? So I always like to make my patients feel comfortable first. Like, I walk them through the procedure. I encourage them to ask me questions to get all their, doubts and queries solved. Also, when I am performing the procedure, I like to, inform them at every step.
Correct.
Like, what we are doing, what is the taste you may expect, what is the smell you may expect, will this hurt or not? Because believe me, we have studied this micron of tissue in so much detail that throughout our specialty program that we can anticipate at every stage, like, when, if and when the patient is going to feel any sensation or not. We anesthetize the tooth in such a way that, the patient is very comfortable and, does not feel any pain.
You spoke about anesthesize. Is that required in every procedure or
No,
not
all root canals.
But if the person is
required.
sensitive to pain,
Still, it is possible to do a root canal without local anesthesia as well.
तो मर्द को दर्द नहीं होता टाइप ऐसे कोई चाहिए होगा जो रूट कनाल बिना एनेस्थेशिया के करे, ये कैसे पॉसिबल है डॉक्टर?
No. So there are certain cases or certain indications in which a root canal can be done without anesthesia as well. And just like you, there are patients who do not believe that this can happen. But believe me that once I start the treatment and, it's like almost 5 to 10 minutes through the treatment, they realize that yes, what Dr. Pooja said is right. I am so comfortable. I'm not feeling pain. And there are so many times where the patient just, goes off to sleep throughout the procedure.
I would like to add one thing here, Dr. Pooja. I strongly believe that there are a lot of doctors, but हर डॉक्टर के हाथ में शिफा नहीं होती. So if they say, then there is some magic in your hands.
क्या बात है?
I'm telling you, because
I take it as a compliment.
ये खाना बनाने में भी होता है कि हाथ की बात होती है. As a doctor as well, हर डॉक्टर के हाथ में शिफा नहीं होती. There are some of them, they connect with you on what level I don't know, but whatever they would suggest you, the treatment that they would do would be so easy, and I think that is one of the reasons.
Thank you so much.
डॉक्टर पूजा, ये रूट कनाल वापस आ सकते हैं वही दांत में जो आपने किया है रूट कनाल ट्रीटमेंट, वापस वही दांत में प्रॉब्लम्स आ सकते हैं जिसकी वजह से आपको वापस करना पड़े उस पे?
Yes, it is possible. Mainly because, that even after root canal treatment, it is important to, maintain your oral hygiene and go to your dentist for regular follow-ups. We say that if you do not have any treatment done in your oral cavity, it is important that you visit your dentist once in 6 months or even once in a year. But if you already have a root canal treated tooth, it is important that you visit your dentist just for regular follow-up every 3 to 6 months. Because as you say, as I said, it's like your tooth has suffered a heart attack and you have made a bypass surgery. So what does your cardiologist say after the bypass surgery?
Check karte raho.
Exactly. Like, get your blood test done regularly, lifestyle modification, diet modification. Similarly, I would say that when you have a root canal treated tooth, take good care of it. As good as, it's your natural teeth. Maintain your oral hygiene. Brush twice a day. Floss at least once a day. Use a mouthwash whenever brushing is not possible or not accessible, and have a good diet. Avoid starchy, sugary foods and drinks. Avoid something which is excessively sour, like a lemon juice or orange juice, or make sure at least you rinse your mouth or have a sip of water after every time you consume something which is too acidic or too.
And Dr. Pooja, for example, I have this habit. Sometimes now I have started to give it a change.
Toothpick?
Usually not of course during Ramadan, but in usually generally lemon and honey early in the morning. Warm water.
Yes.
So once somebody told me that this is so
acidic.
harmful for your teeth. Is that true, or does it have any grounds?
Yes, partly this is true because lemon is highly acidic. So it alters the pH of your mouth, and whenever the pH drops inside your oral cavity, it is like an invitation for bacteria to come and take over and form their colonies over the tooth and initiate the process of decay. It also kind of tends to dissolve or demineralize your enamel, which is the outermost protective layer of your tooth, making the tooth more susceptible to attacks sensitivity and all of that. So
And somebody suggested me that use straw and drink.
Yes, that would be
Is
best.
that a good?
Yes, because
interesting.
in that way you can bypass. I was about to say that because in that way you bypass the the acidic fluids. coming in direct contact with your teeth.
या मुंह भी बड़ा खोल के आप इसे डायरेक्टली ऊपर से नहीं सीधा not reaching anywhere.
क्या बात है.
If it is warm water, I would recommend not doing.
अच्छा हुआ ये डॉक्टर नहीं है. अच्छा, हमारे लिसनर का जो है वो मैसेज आया था, वो कह रहे थे ये भी बहुत लोगों को प्रॉब्लम है, लेकिन कुछ लोग पूछते हुए घबराते हैं. बैड ब्रेथ.
Yes.
क्या बहुत परफ्यूम लगाएं या कुछ इलाज है इसका?
मुंह के अंदर कैसे आप डिओड्रेंट लगाएंगे?
मतलब गले के
परफ्यूम फॉर
कॉलर पे नहीं. हाँ, there is फॉर पीपल वो जो बच के ऐसे वो.
हाँ.
No, that is just a mint spray. It's just to kind of neutralize or mask the tobacco smell or something like that. But it is not therapeutic, or it is not taking care of your oral hygiene. It is just like something to cover up, as you said. It is just to mask the bad odor. It will not take care of the cause. Mostly in Ramadan, during fasting, bad odor or halitosis is more common. That is because prolonged fasting puts your body into a state of dehydration, and it causes acid reflux. So dehydration affects the soft tissues of your oral cavity, which is your gums and your mucosa, and the acid reflux attacks on the hard tissues of your oral cavity, like your bone and your teeth, basically, making them more susceptible to.
So how will we know that the bad breath is coming because of empty stomach or problems in your mouth? Is there a
bad breath is due to problems in your mouth? An empty stomach will not cause bad breath at all. Okay. So because of an empty stomach or because of dehydration, your tissues kind of dry up. The condition is called as dry mouth or xerostomia. And in xerostomia, there is decreased salivation in your oral cavity. And saliva forms a protective film over your teeth.
Is it?
Yes. So it protects your tooth from any bacterial invasion. When there is no saliva or a reduced salivation, you have a dry mouth. It is like it is an invitation for the bacteria to come and take over and
so
form their colonies. So it is advisable that you use mouthwash. Even before your prayers, when you do wudu or ablution, when you rinse your mouth, rinse it properly. You can gargle your oral cavity with making sure that the water does not enter your throat. And you can also use mouthwash. You can use floss. All of these are absolutely compatible with the fasting.
Ramadan,
yes.
But otherwise as well, people who have bad breath and they feel very nervous and conscious about that.
Yes. So it is very important to do regular scaling and polishing, which is basically the cleaning of your tooth. A professional cleaning is very important because how much ever active, motivated and dexterous you are, the oral cavity is such a place where the toothbrush will not enter all the places, and it will not be possible for a person to clean his mouth in all areas by himself. That is why we advise visit a dentist and get professional cleaning and polishing done at least once in 6 months.
So that makes us ask that at Medstar, because Dr. Pooja wahin hoti hain, what else can people, the services that are available?
So at Medstar, we are a team of internationally trained dentists, and we have a huge team of dental doctors who specialize in different areas of dentistry. Like I said, I am a root canal specialist. I'm an endodontist. So my services are targeted towards saving your natural teeth. But unfortunately, if you have lost a tooth and you want to place an implant or looking for a replacement, we have an oral and maxillofacial surgeon, a very renowned dentist.
You have that Hollywood smile kind of
stuff.
Yes.
Cosmo
that is cosmetic
treatment.
Yes, we
but
have veneers.
Right?
Very popular.
Yes, it's very popular. We have veneers.
No harm with it if you do it?
Not at all, because in veneers we actually only remove the minimal amount of tooth structure. There is something called as lumineers also, in which we do not prepare or do not remove any layer of the tooth. It's like an add-on, which is put on the top of your existing tooth without causing any harm or damage to your enamel or the outermost layer. So that is there. At Medstar, we also have the specialty of orthodontics, which deals with braces and alignment of teeth. So
and you do the invisible braces?
Yes, we do Invisalign, we do Sure Smile, we do all the possible. There are so many advancements in dentistry, as I said.
Correct.
That's why it's not painful anymore. It's not cumbersome. The patient is always at ease, at comfort. We also have advancements in radiology, or the investigation part in dentistry, such as cone beam computer tomography. We have a dedicated X-ray center, or X-ray unit, you can say, in Medstar, which does these kind of advanced which uses these advanced technologies, in which you can observe a root canal in all 3 dimensions. So even before I open the tooth for the root canal, I have the exact, precise picture
I wouldn't
of the
want
tooth.
to see it.
Nice.
It's better to be ignorant. But ये तो था Medstar. So, Dr. Pooja, is there a way? Are you on social media where people can check out how much a patient is screaming when they are getting treated by you?
No, I'm very active on my Instagram handle. I do post tips and various snippets
Sessions
to
okay.
to keep
Tips
my
and
patients
all.
aware and how to take care of their health. So you can follow me at Dr. Pooja Sathe on Instagram. You can also follow me at the Medstar handle, which is Medstar Multi-Speciality Center. So I keep adding my video testimonials and patient reviews as well.
Dr. Pooja, so glad we met. We are going to see each other very soon.
Look at Sobia's smile. She's so
Looking
happy.
forward.
Always smiling. Can't
So
help it.
medstarhc.com पे भी आप लॉग ऑन कर सकते हैं. So quickly, just to give a summary of whatever we discussed, painful नहीं होता root canal, जाना पड़े root canal के लिए, लेकिन every 6 months is what you need to check with a dentist.
Yes.
Fluoride based toothpaste ज़्यादा अपनाइए.
बच्चे हों या बड़े?
Yes, that's correct.
Anything more you want to add, Dr. Pooja?
No, just make sure you have a healthy diet, take good care of your teeth and your overall mind and body.
Best advice is free. For everything else, there'll be some charges. But not on Talk Breakfast. So really appreciate Dr. Pooja, and of course thanking Medstar as well. कि उन्होंने allow किया, busy schedule होता है, और ईद से पहले तो आपको पता है कि स्माइल और सारी
ये
चीजें
सब तैयारी करनी पड़ती है. हाँ.
जी सही समझा आपने. हम भी तैयार हो जाए.